A patient's physiological state can appear locally stable during periods of clinical calm. Small fluctuations in biomarkers arise and then return toward baseline. This local behavior creates a strong clinical intuition of stability. The patient looks controlled. The disease appears well managed. But local observation near baseline is not global evidence. A calm clinical neighborhood does not mean a safe physiological state space. Near a physiological set point, regulatory forces balance. A small perturbation to the patient's state generates a restoring response. Deviations from baseline diminish over time rather than grow. This is local homeostatic stability. It is physiologically real and bounded in scope. It holds within a neighborhood of the set point. The neighborhood is not the entire physiological state space. Outside it, the regulatory analysis no longer applies. The physiological state space extends far beyond the local homeostatic region. Near the set point, linear regulatory dynamics govern. Farther away, nonlinear disease dynamics take over. New pathological forces dominate. The patient is no longer protected by local homeostatic balance. A claim of global patient safety requires evidence across all physiological states. Local clinical observation cannot provide that evidence. Every stable physiological set point has a basin of attraction in the clinical state space. It is the set of all states from which the patient's physiology eventually recovers. Inside the basin, trajectories return toward the set point. At the basin boundary, the regulatory dynamics change entirely. Beyond it, return to normal physiology is no longer guaranteed. Basins are finite regions in the physiological state space. Crossing the boundary changes the patient's clinical fate permanently. A low-probability clinical event can push the patient across the basin boundary. Inside the basin, the patient's trajectory looks stable. After a severe enough insult, that changes in a single episode. The patient now lies outside the homeostatic basin. Local regulatory forces offer no restoring response from that state. The event does not need to be likely. It needs to occur only once. Some clinical states are absorbing. Once the patient enters end-stage organ failure, no local regulatory force can restore prior function. The homeostatic dynamics cease. Local stability may have held for a long period before the absorbing state was reached. That clinical history is irrelevant once the absorbing state is entered. Global physiological structure overrides local homeostatic balance. Clinical stability is conditional. It holds within the basin, not across the entire physiological state space.